All right. Hello, everybody. Welcome this evening. We are here for our webinar, Basics of Chronic Kidney Disease. Thank you for joining us. I hope that you will enjoy the presentation this evening. Just a couple things to get us started. Our format includes a short presentation followed by an interactive discussion. At the end, there will be a chance for questions. We would love some questions. To type in a question, there is, you'll see on the toolbar, you'll see the question section. Just click on that and you'll see where you can type in your question, because we do look forward to this being an interactive webinar. All right, some disclaimers. The Cecilia Health registered dietitian presenting today will provide some strategies to help manage your chronic kidney disease. And we know that the information you are about to hear may motivate you to make some lifestyle changes, but please consult your physician before making any changes to your current routine. And then we get to the Q&A section. That is intended to give general advice. Information is not a substitute for personal medical advice and involves the professional opinion of the Cecilia Health dietitian.
Hold on. One sec, everybody. So funny. Just having some technical challenges. Don't you always love that? One sec, here we go. Back.
Okay. And so our dietitian today is Nancy Cohen. She's a licensed registered dietitian, presently living in Pennsylvania. She has her degree in nutrition and dietetics from the University of Florida and has been working in the nutrition field for over 40 years. She educates clients in all areas of medical nutrition and wellness and is happy to be a member of the Cecilia Health team. She is a mom to an adult 30-year-old son and has a passion for her beautiful Weimaraner dog, Dinah. And she loves to work with all of her clients online in the Cecilia Health CKD program. And she brings a positive attitude to all on ways to incorporate good nutrition into life and make the most out of every day. So, all right, Nancy, take it away.
Oh, thank you very much. Welcome, everybody. I'm so glad that you're here. Happy January 2024. We're going to start our presentation, and if you're listening from at home on the recording, we're glad you tuned in also. Okay, so tonight's presentation is about kidney health, and these are the topics that we will be covering in the webinar. What your kidneys do and how they work. What is chronic kidney disease? The risk factors for chronic kidney disease. Some of the complications, symptoms, staging and progression, diagnosis, management, medications, and reliable resources. So here we go. Okay, so let's talk about your kidneys. So most people have two kidneys, and they are the size of an adult fist on either side of the spine below the rib cage. And the kidney functions to help remove waste and excess fluid. It also filters the blood, and it also makes vitamins that control growth. Kidney functions also include controlled production of red blood cells, and they also assist in releasing hormones that help regulate blood pressure. So you can see their great value. Chronic kidney disease, also called chronic kidney failure, involves the loss of kidney function. More than 37 million American adults may have chronic kidney disease, and most are undiagnosed. Advanced chronic kidney disease can cause dangerous levels of fluids, electrolytes, and wastes to build up in your body. And this disease is chronic because the damage to your kidneys happens slowly and over a long period of time. Chronic kidney disease can also cause other problems. There, I have to move it one more time. Sorry, everybody. I don't know how many of you love working on the computer, but I do my very best every day. If you're in my students, you know that I love to work on the computer. Okay, here we go. Next slide. So let's look at how the kidneys work. Well, in number one, the blood enters the kidneys through an artery from the heart. And then over to number two, the blood is cleaned by passing through millions of tiny blood filters in the kidney called nephrons. And then in number three, the waste material passes through the ureter and is stored in the bladder as urine. And then over to number four, newly cleansed blood returns to the bloodstream through the veins. So these kidneys are really important. If you're in the program with us, you've heard this term chronic kidney disease. So chronic kidney disease has other factors. It can be affected by diabetes, high blood pressure, heart problems, obesity, family history, tobacco use, and age. And there are some other issues that we keep in mind. If you are Black, Native American, or Asian American, if you do have a family history, or if you have abnormal kidney structure, or consistent use of medications that can damage your kidneys. Some of the complications of chronic kidney disease, or CKD, include fluid retention, which could lead to swelling in your arms and legs, high blood pressure, or fluid in your lungs, called pulmonary edema. A sudden rise in potassium levels in your blood, called hyperkalemia, which could affect your heart's function and can be life-threatening. Anemia, which is low iron levels, heart disease, weak bones, and an increased risk of bone fractures. A decreased sex drive, erectile dysfunction, or reduced fertility. Damage to your central nervous system, which can cause difficulty concentrating, personality changes, or seizures. Decreased immune response, which makes you more vulnerable to infection. Pericarditis, an inflammation of the sac-like membrane that envelopes your heart, which is called the pericardium. Pregnancy complications that carry risks for the mother and the developing fetus. And irreversible damage to your kidneys, end-stage kidney disease, which eventually requires either dialysis or a kidney transplant for survival. So let's look at some of the symptoms of CKD. Some of the symptoms include nausea, vomiting, loss of appetite, fatigue and weakness, sleep problems, urinating more or less, blood in your urine, painful urination, frequent urge to urinate, a decreased mental sharpness, muscle cramps, swelling of feet and ankles, dry, itchy skin, high blood pressure, shortness of breath, and chest pain. Okay, so this is a really interesting slide. And the good news is that there are many different stages of kidney disease. So let's take a look at them. And we talk about those often if you're in coaching with one of the dietitians. So in stage one, you might not have symptoms, but you might have other signs of kidney disease like protein in your urine. Stage two, You may not have symptoms, but you might have protein in your urine. Stage 3, you may experience high blood pressure and bone disease as waste begins to build up in your body. Stage 4, the waste building up may cause high blood pressure, bone disease, and heart disease. You likely have such symptoms as swelling of your hands and feet and pain in your lower back. And this is the last stage to kidney failure. And stage 5, your kidneys are close to failure or already have failed. And since you are not able to filter waste out of your blood, you become very sick. Survival now depends on dialysis or a kidney transplant. So there are 5 stages: stage 1, 2, 3A, 3B, 4, and 5. And it's actually determined by the GFR. We're going to talk about that in the next slide. So if you've been in the CKD program, we always ask you for your GFR. And it's something that you can ask your doctors about for certain. So the GFR is a blood test, and it is the main test for kidney disease. The GFR checks how well your kidneys are filtering your blood. And the GFR stands, so this is what the initials stand for, glomerular filtration rate. And that's how well the glomeruli are the cells in the kidney, and that's how well they're clearing. So the GFR blood test, the good news is that the higher the number, the better, or the higher the stage, closer to 1, 2, 3, or 4. So the lower the number, closer to the lower 4 and 5. Okay. And then another test that we look at often is called the microalbumin urine test. And microalbumin urine test can reveal abnormalities that point to kidney failure. And albumin is a protein that can pass into the urine when the kidneys are damaged. So you may have been asked for your microalbumin urine test value also. In diagnosing CKD, the albumin to creatinine ratio, or the ACR, is one of the tests that we ask about. ACR is calculated by dividing the amount of urine albumin by the amount of urine creatinine. And higher amounts of albumin in the urine can be a sign that the kidneys are not working as well as they should. Another form of diagnosis is imaging, and an ultrasound can assess your kidney size and structure. And then a third form is a biopsy, which involves removing a sample of kidney tissue, which is then sent to a lab for testing to help determine what your kidney's problem is. So here we go. So the management of CKD, chronic kidney disease. So these are the guidelines that we suggest that assist us to manage our CKD. We invite you to work on controlling your blood pressure. Recommendations include controlling your blood sugar. They also include monitoring your kidneys with your healthcare team and taking your medications as prescribed. Working with a dietitian to help you create a meal plan, and make exercise a part of your routine. Aim for a healthy weight and get enough sleep. And if you smoke, quit smoking. Find healthy ways to cope with stress and depression. So these are many of the goals that we invite you to. They're good for all types of health, yes, but we ask you to look at these when we're looking at chronic kidney disease. It's very important to take your medications, but there are no specific medications to treat chronic kidney disease. Your doctor may prescribe medications to help prevent and manage other health problems that also influence your CKD. So if you have diabetes, Then there's insulin or oral medications that help there. If you have high blood pressure, then there are ACE inhibitors. There's angiotensin receptor blockers, beta blockers, and diuretics. And if there's heart disease, then those medications include diuretics, ACE inhibitors, beta blockers, and potassium binders. If you have high cholesterol, the medications there include statins. And if you have anemia, there are two types. One is called erythropoiesis stimulating agent, and that means it basically stimulates making red blood cells, and or iron supplements. If you have metabolic acidosis, then your doctor may prescribe sodium bicarbonate. If you've had bone disease, then they may recommend phosphate binders, calcium, and vitamin D. And if you have secondary hyperparathyroidism, then a calcimimetic or calcium or vitamin D. Lots and lots of different medications for each individual. So we at Cecilia Health feel very strongly that you should get your information from reliable resources. So we don't want you just to Google information. We stand by those that have done research, and these are the ones that we really like to recommend to you. So the National Kidney Foundation has wonderful resources for information for you. The Centers for Disease Control and Prevention also provide resources that are of value and credit. The National Institute of Diabetes and Digestive and Kidney Diseases, very qualified and reliable. The American Kidney Fund has wonderful information. And then, of course, the American Diabetes Association. If you also have diabetes, that's a great place to get factual information. So be sure that you're not just doing what your neighbor told you, but that you're listening to information from a qualified resource and, of course, your physician. So that is there's a lot of information in this presentation, and I'm really glad you're here. If you have some questions, please put them in the toolbar, and I'm happy to answer them for you. So if you have a question, you can just type it in. Well, I'm really honored to be working in the chronic kidney disease department of Cecilia Health. And I love working with those of you that do have the challenges of chronic kidney disease, whether they're in stage 1, 2, 3, 4, or 5. And I get this question often from my clients. And so I'll share the question with you and then give you the answer. And the question is, can my kidney health improve? And through following the recommendations, so each one of you that works with someone at Cecilia Health has a nutrition coach, and you can ask them individual questions about your own stage and the nutrition that goes along with that, and you can share with them how you're doing with your medications and goals. And you know, we love to set goals with you. But the answer to the question is, can your kidney health improve? And while we cannot guarantee that, of course, I have absolutely seen several clients have lots of positive results from following the recommendations for their diets and then having their lab work repeated and seeing improvement there. So remember, we said earlier that there are a lot of different areas that help improve kidney health. Managing your diabetes, watching your weight, monitoring your sodium intake, planning a diet with your dietitian, getting some exercise, Also, if you smoke, don't smoke. Adequate sleep. So there's lots of things that can help improve your health, and those are some of the goals you can work with your nutrition coach. So does anybody have another question? I have one coming in. Okay. The next question I have here is, do I have to limit my protein intake? And this is such a good question, especially in light of all of the information that's in the media today that says you need to eat high protein, protein builds muscles. So the answer to the question is, do you have to limit your protein intake? And again, this is based on an individual basis, and each person will have a different amount of protein that they are required to consume, but we do not limit protein per se. We have recommendations from 0.8 grams of protein per kilogram up to 1, and it depends on your stage of chronic kidney disease. So a high protein diet isn't necessarily appropriate, but unless you're at stage 4 or 5, we don't recommend a low protein diet either. So please be sure to check with your nutrition coach or your physician to find out if there's a limitation to how much protein you should have. As a rule, it's not as strict as you might believe. Okay, let me see if anybody else has another question here. Okay, I have another one coming in. What if I don't know my stage of kidney disease? Will this matter? Well, that's a really good question. And what I would recommend you do is always stay in touch with your doctor. Make sure that you're having your physicals and asking questions about your lab work. They're going to direct you the best that they can. But what we do recommend generally here is having a healthy amount of sodium, not more than 2,500 milligrams if you don't know your stage of chronic kidney disease. Eating a healthy, balanced diet with fruits and vegetables if you have not been given any restrictions, eating lean, healthy proteins, and as long as you haven't been given a fluid restriction, then drinking adequate amounts of liquids. But without knowing the stage, without working on those other lab works, I would recommend a good, healthy diet for good, healthy blood pressure and good heart and watching your weight. So there are no true restrictions, but just some common sense tips for a healthy diet. And I believe that we actually have that webinar coming up next month. So that is very exciting. So let me just ask you again, does anybody have a question? You can just type it in the toolbar. Okay. So I love my little, I can't go forward again. Oh, here we go. Okay. And then go back here. There we go. Okay. Great. Okay. So, thank you everybody for those great questions and sticking around to have them answered. And remember, there's a team of us, of nutrition coaches with Cecilia Health. So please be sure to check in with them with any of your individual questions. In a few weeks, we have another webinar coming up. So you are always welcome to sign up for them. We're thrilled to have you with us. On February 15th, we have one on chronic kidney disease and cardiovascular disease. And this live event will discuss the basics of chronic kidney disease and cardiovascular disease, including several important topics like risk factors, complications, resources, and more. And then I'm imagining it's going to be in March, but check our webinar listings. There's a really great presentation on healthy eating with kidney disease. So be sure to tune in for that one. And again, any individual questions, please check in with your nutrition coach or your physician who will give you the personalized information that you need. So we're very happy to have you come to our events. Ask your clinician, ask your coach who's working with you, and or ask them for the emails and the information about the online events. And if you have not yet signed up for text messaging, ask your clinician how to do that. But most of you have, and if you haven't, then just let them know that you'd like to receive text messages from us because we make that arrangement. And then, of course, we have really neat tips on Facebook. So just look for us on our Facebook page called Cecilia Health Coaching, because we always have interesting research articles there. And then, of course, that awesome Cecilia Health website that you can all have access to, because they have nice blog posts and other things that you can read. So we're really happy to have you in our family. So,
All right.
Ashley, did you want to say something? Go ahead. Thank
Well,
you.
I was just going to wrap it up and say thank you for presenting today, Nancy,
Oh,
and
my
thank you everyone for
pleasure.
joining us today. I hope that you learned some things and maybe they even stimulated some, thoughts that you know you can talk about personally with your coach next time, or your physician, of course. So as we wrap up, I did want to let everybody know that all these slides are made available. Uh, what we'll do is we'll put them on the website where you registered for this. If you scroll down, all the recordings are below there, so you can look at any presentation from the past, including this one. It'll probably get up, I'm going to say, by the end of this week, for sure early next week, if you want to be able to go through the slides again, because I know some of those had a lot of words on them. So, but if you want to review anything as well. So, thank you so much, everyone, for joining us. Thank you again, Nancy, and we will hopefully see you next month.
Bye, everybody. Thank you. Have a great week.
All right. Bye-bye.